healthcare worker infected, repatriation flights resume, and RBDF handover. Good morning, everyone. I'm Akush Lapinder, and this is your morning edition. The new process for inter-island travel to those islands that have resumed commercial activity began on Wednesday. Travelers are now required to submit an evaluation done by a Ministry of Health authorized public or private physician, which includes a risk assessment questionnaire to determine the individual's level of risk for COVID-19. Our Lloyd Allen spoke to Deputy Chief Medical Officer Dr. DeLon Brennan on that process and other concerns related to the COVID-19 pandemic.
As far as we can tell, things are starting to progress. We have people that are registering with our COVID-19 email, and they're letting us know they are looking to travel, and so we are receiving those applications at present. So as we process those applications, and we will be letting people know where they can go to have their evaluations done in order to move process with getting a travel authorization document in order to move around the island.
Also, a new case reported overnight. What can you tell us about this new one?
The case was a contact of a previous case, and we'd been monitoring them. It was a healthcare worker that had no symptoms but needed to go back into a healthcare environment, and so they were tested and found to be positive and just an asymptomatic carrier. So obviously we now have placed that person into isolation, and we're going to monitor them going forward.
According to the numbers, can you confirm if there is an online database for the mapping of COVID cases as well as the numbers over the past 9 weeks?
Well, we've been working with the Bahamas National Geographic Information Service, and so we have been providing them with the addresses of persons so that they could map it for us. So they are actually in charge of that exercise.
The 311 emergency number was given as a contact for people needing assistance during the curfew and lockdown periods. These, of course, not referring to essential workers. Has that emergency number been useful in managing your graphing of cases?
We have not used the 311 for that particular purpose. It's been more of us doing the Ministry of Health doing its contact tracing and then getting the addresses and providing them. So it's been through a different mechanism.
We have heard a lot about the opening of the economy. Tell us, though, what are some of those discussed general proposed protocols for the public once we return to work, school, and other areas?
I think the major things are going to be continuing with the same mantra of social distancing, making sure that we make accommodations for how we can do what we used to do, just in a different manner. It is likely that masks will be encouraged for the foreseeable future as well. We will ask that businesses, schools, recreational areas put in more facilities for people to be able to do hand washing. So that'll be mandatory to make sure the other facilities for good hand hygiene as well. So those are, some of the things that are going to be mandated to make sure that they're in place so that we minimize people's ability to spread infections, including coronavirus, from one person to another.
Well, as indicated, we're one up from where we were yesterday in terms of confirmed COVID-19 cases. That then puts the local count to now 97, ending a 6-day stretch. The recent case, as you just heard the Deputy Chief Medical Officer say, coming out of the capital, the 50-year-old New Providence man is said to be isolating at home. Now, this latest case puts the total number here in the capital to 75, 13 in Bimini, 8 in Grand Bahama, and a gang 1 in Cat Key. Looking at the numbers from the latest dashboard, we can also tell you recovered cases went to 44, hospitalized decreased to 6, and tests completed at 1,872. 5.1 million now the count for global COVID cases, with a 2+ million count for the recovered.